Hello everyone and welcome to set 27 of the part 1 questions. Let's get going. First question here, metastases to the brain, liver, and bone commonly come from which locations? So the first one on the brain, where's it coming from? Well, we think about the lung, breast, skin like melanoma, kidney cancer like renal cell carcinoma, and then the GI. About 50% of brain tumors are metastases. Liver, where's it coming from? Well, after regional lymph node metastasis, you got to think about the colon, you got to think about the stomach, pancreas, breast, and lung. And then the bone, think about prostate cancer, thyroid, testes, breast, lung, and kidney. Next question. A central line is often placed in the subclavian vein to administer fluids and medications or to measure central venous pressure. What landmarks are used when placing a subclavian central line? So here you're going to put your thumb on the clavicle, around the middle third of the clavicle, and then you're going to put the tip of your index finger on the jugular notch, so the top of the manubrium. Then you insert the needle medially along the inferior surface of the clavicle below your thumb, aiming roughly at the tip of your finger. Next question. What is the mechanism of organophosphate poisoning? What are the symptoms of cholinergic excess? So what is the mechanism of organophosphate poisoning? So you need to know what's happening at the cholinergic nerve terminal. When acetylcholine is released, some of it binds to the postsynaptic receptor, but some of it will be degraded by acetylcholinesterase enzymes. So if there's an organophosphate around, that will inhibit and inactivate that cholinesterase. So then you get that acetylcholine is going to stay around longer in the synaptic cleft. So acetylcholinesterase inhibitors effectively enhance cholinergic transmission, and this can lead to a toxic buildup of acetylcholine. So then what are the symptoms of that cholinergic excess? You got too much acetylcholine. Well, the mnemonic we've used for years is dumbbells, and that stands for diarrhea, urination, meiosis, bronchospasm, bradycardia, excitation of skeletal muscle and CNS, lacrimation, salivation, and sweating. Next question. Which glycogen storage disease fits the following features? So first we have severe hypoglycemia with elevated blood lactate. This is von Gierke's disease, or type 1 glycogen storage disease. Next we have hypoglycemia without elevated blood lactate. That's going to be Corey disease. That's going to be type 3. Cardiomegaly, that's going to be a feature in Pompe disease, so that's type 2. Remember, Pompe trashes the pump. And then myoglobinuria associated with exercise is McArdle's disease, that's type 5. Next question. What are the most common locations of lung cancer metastasis? So the big one here, the big ones are the liver, to the bones, into the adrenal glands, and the brain. Now, some of those are more symptomatic than others, but those are the most common sites. Next, what is the treatment of pulmonary embolism? So you're going to use IV heparin or low molecular weight heparin, which is enoxaparin, and that would be the first line treatment for a pulmonary embolism. Both of these drugs work by activating antithrombin, which will halt clot progression. Usually we don't use a thrombolytic like TPA like we do with an acute ST segment elevation MI. Now if a patient has had problems with heparin in the past, such as heparin-induced thrombocytopenia, then the alternatives include lepridin and bivalirudin, which can be used, and these two drugs directly inhibit thrombin. Next, what is the characteristic fetal complication associated with lithium use in pregnancy? What other agents used to treat bipolar disorder can be teratogenic, and what are their corresponding fetal effects? So the one we want to talk about with lithium is called Ebstein's anomaly, and this is where the tricuspid valve leaflets are displaced way down in the right ventricle. Another way of saying this is that the right ventricle is atrialized. There is usually some tricuspid regurg or stenosis as well. Now, what other agents used to treat bipolar disorder can be teratogenic, and what are their corresponding fetal effects? Well, carbamazepine can cause neural tube defects, craniofacial defects, intrauterine growth retardation, developmental delay, and also hypoplastic fingernails as well. Valproate inhibits maternal folate absorption, and that can cause neural tube defects as well. Aripiprazole and risperidone are atypical antipsychotics that aren't technically teratogenic, but they are definitely problematic because they can cause extrapyramidal symptoms in newborns. Next question. What are some of the functions of bile produced by hepatocytes and stored in the gallbladder? What hormone is the most potent stimulator of gallbladder contractions. So why do we make bile? What does it do? Well, bile emulsifies large fat particles into smaller fat particles that can then be degraded by lipase from the pancreas. Now, bile acids in the absorption of digested fat and products is another function as well. And this is by facilitating fat absorption. Bile is also essential for the absorption of those fat-soluble vitamins. So things like vitamins A, D, E, and K. So ADEC, you can remember that being your fat-soluble vitamins. Bile is important in the excretion of bilirubin because bilirubin is dissolved in that bile. It gets excreted in the stool, and that's what gives the stool its color. Bile also is important for the excretion of copper, and it also allows for the excretion of cholesterol. So, and then what hormone is the most potent stimulator of gallbladder contraction? That's going to be CCK for cholecystokinin. Next question. What are the common causes of Herb Duchenne palsy? Where is the brachial plexus insult with Herb Duchenne palsy? So Herb Duchenne palsy results from severe traction or an actual tear of the upper trunk of the brachial plexus, so C5 and C6 roots. Now this results in paralysis of abductors, lateral rotators, and supination as mediated by the biceps. Consequently, the arm hangs in sort of an adduction, medial rotation, and pronation of the forearm. So it usually follows a blow to the shoulder or from trauma during delivery. Next question, what anatomic structures are found in the retroperitoneum? So we use this mnemonic SAD pucker. So suprarenal adrenal glands. We've got aorta and IVC, duodenum, pancreas, except for the tail, ureters, colon, kidneys, esophagus, and rectum. All right, guys, that brings us to the end of set number 27. I hope you learned something. I'll see you next time.